We have 5 more minutes, 6 minutes more.
About
3 minutes.
3 minutes. 3 minutes. But we'll give people a couple of minutes to join.
Yeah. That's what I'm saying. Let's give them some time.
Now you're not able to see my screen, right? And I can see my slides. I'm trying to see both. So I have to minimize.
Namaskar. Please stand by. We'll be starting in another couple of minutes. Meanwhile, if you have any questions for Dr. Jandhyala, would you please start typing them into the chat window? I will remind you of that again. But if you have questions already, you can start typing them in, and we will take them along the way.
People tend to forget. You have to remind them.
Yeah. My pretty much every day is on video.
Namaskar, good evening, and welcome to today's session. We're about to begin in another minute or so. We're going to begin with Lataji chanting the opening prayers, and then I will introduce Dr. Ravi Jandhyala, and then we will have an interactive session. The session is interactive, and so if you have questions or things that you would like to address, we will. You can start typing them now. I will pick them up along the way, and then we will try to answer as many questions as we can today. Thank you. And
Shall we start?
good to begin. Lataji, should we begin? All right, let's
Everyone, come to sitting attention position. Back, neck, and spine in one straight line. Bring your hands to heart center in a Namaskara Mudra. And let's start with the opening prayer, Shanti Mantra. Inhale. Om. Om Sahana Vavatu Sahanam Bhunatu Saha Viryam Karavavahai Tejasvi Namadi Tamastu Ma Vidvishavahai. Om Shanti Shanti Shanti. Gently rub your palm. Cover your eyes and with a few blinks, open your eyes in your palm. Namaste. Welcome to the session today. Very interesting. Gauravji.
Namaskar. Thank you, Lataji, for starting us off. I'd like to welcome you to today's interactive session with Dr. Ravi Jandhyala. The topic of our session is how to prevent a heart attack, and this is going to be interactive. Dr. Ravi Jandhyala, it's my pleasure to introduce you to him. He is the MD and Director of the Cardiac Catheterization Lab at Kaiser Permanente in Orange County, California. And he's been practicing interventional cardiology in Orange County for over 20 years. He's very experienced in cardiac catheterizations, angioplasties, and coronary stents, rotablators, and percutaneous aortic valve replacements. Yes, full stop. He's done thousands of procedures over the last 25 years, and he loves prevention of bad health in having a sattvic lifestyle and believes in yoga and meditation for 1 week, in addition to nutrition, to nourishment, activity, and good attitude. A personal side note, I met Dr. Ravi Jandhyala last year when he was organizing the Global Gita Conference. I know Dr. Ravi is a fantastic gentleman. He has a great heart, which is fitting for a heart doctor. And he is extremely calm and unruffled despite organizing events while running operations. I would occasionally talk to him after he's just done an operation, and we would have a really pleasant conversation. So this is a doctor whose safe hands you want to be under. This is an interactive session. So if you have questions, you may please type them into the chat window, and we will try to catch them along the journey. And if you have any other comments, please let me know. With this, the presentation that Dr. Ravi is using, I have a copy of that, and we're happy to share that with you after. This session is also being recorded. If you'd like to view it later, you can send me a text, and I'll send you the link. With that, Dr. Ravi, I'd like to welcome you, and thank you for being here.
Thank you, Gaurav. Thank you, Lata, for having me. I'm an interested observer, so I've learned from various different experts about the heart disease, about wholesome well-being. What I share here is essentially not something to prevent a heart attack. It could prevent a lot of bad things that can happen to us. So with that, my topic is heart attack. Is it karma? Is it inevitable? Or is it preventable? We all know, we hear about stories. Lata was just sharing a story of a friend who's 45 years old and had a heart attack, which she would probably do it in the Q&A. Heart disease is real. It is the leading cause of death in United States as well as in India. And with more equipment available in India, like EKG machines and hospitals with advanced facilities, we are noticing that we're recognizing more of these, and the incidence has also increased because of the lifestyle. So in the past 3 decades, the heart disease has doubled in the villages and tripled in the cities in India. The guesstimate is probably, if we had 10 classmates of my age, 1 in 10 of them would have heart disease, whether they know it or not. So it's probably 10% in the adult population. And it's been noticed in India that we are seeing people with heart disease at a younger and younger age. We used to think, you know, our father had heart attack, So it has been striking early and unexpectedly. And it seems to be happening in Indians about 10 years earlier than compared to the population in the United States. And it appears that about a third of the patients, it happens before the age of 45, in India especially. And we think, diabetes might be the cause. There are probably more than one cause, and probably the main cause that will all boil down to is poor lifestyle. At one point, 30 years ago, when I started training in the United States, the incidence is probably similar in India and the United States. Now, in India, the incidence, the capture of heart disease is 4 times more than the United States. So there's a 50% decrease in heart disease in the US and about 200% increase in India. So a civilization that we are from, which actually preaches and practices a sattvic lifestyle, we are going farther and farther away. And we are probably aping all the not so good things from other cultures, the Western cultures, like fast foods, eating while we are driving, and no relaxation, not giving time to take care of ourselves. WHO, the World Health Organization, which unfortunately is getting a lot of bad rap from all these fake news propagators. It says Indian citizens dying each year from heart disease by 2020 will be 24 lakhs. That is 1 in 4 cardiac patients in the world will be Indian by this year. This was a data that came out 3-4 years ago, and we hope that's not the case. So I just like to show a little, start with what is a blockage, what does cause a heart attack, show little videos and what we do to stop a heart attack. Then I open up with what leads to heart disease, which is the blockage in the coronary arteries, and what is that we can do about it. So I'll probably, Gaurav, if I could take like 20 minutes going over it, then it'll be better we do interactive, but feel free to interrupt me at any time.
Absolutely.
And I will share my screen now and see if this will show up well.
We see your screen now.
Okay, so what you see here is a blockage, a coronary artery. To the left, you see a cross section of the artery, which is a tube. The arteries supply blood to all organs in the body, and this is the artery that supplies blood to the heart. Heart is a muscle that we don't need to tell to start to work. It's involuntary, and it requires nourishment. So the heart gives blood to the whole body, but it takes blood when the heart muscle is relaxing, that is in diastole. And the arteries that give blood are tubes, which have 3 layers. There is an inner layer, which is very delicate, like the lining of the mouth. The thicker layer in the middle is the muscle layer. It's called tunica media, and there's an external layer. To the right, slide B, what you see is a artery of a person who died of a heart attack. Unfortunately, that's why we can see the artery. And what you see in this gray or white is the blockage, and the red part is a clot. So the final cause of somebody beginning to have chest pains to the point of having a heart attack is a rupture of a plaque. So the plaque lining, due to various inflammatory markers, it cracks and it exposes the blood to the inside of this plaque, which is cholesterol, and causes a chemical cascade of clotting, and the opening, which is probably 50%, is closed off by a blood clot. And so there's no blood flow to that part of the heart muscle, and that is called a heart attack. Heart attack is a part of the heart muscle is not getting enough blood flow. And if that continues, it can cause damage to that heart muscle, and about, unfortunately, 2 out of 10 people may not make it. And we hear of stories, somebody dying in their sleep, or just barely making it to the hospital, but not making it.
Sorry to interrupt you. What's the actual size of this tube? Is it like a
Nice.
small finger? What size, diameter?
Yeah, you could say that. So the arteries start big and taper down like roots of a plant. So the arteries at the beginning could be anywhere from 3 to 4 millimeters. As they go down and give many, many branches, the smaller branches become like 1 millimeter. The arteries become arterioles, arterioles become capillaries. So the arteries that we can fix with balloons, stents, and bypass surgery are arteries bigger than 2 millimeters. So we
Thank you.
fix them at the very beginning. It's a very good question. With that, I would like to go to an animation of what happens with this plaque and plaque rupture, if you don't mind. Can you see this anatomy of a heart attack?
Yes.
Yes.
Okay, that's nice. So it's about a 2-minute video, but I will be talking as it's going because the sound may or may not be clear.
This is the story of how too much cholesterol in the body can set up a process that spirals out of control.
Your script is not right.
Are you on mute or not?
Yeah.
Can you hear me okay, the sound from the computer, or it's too low?
No, it was fine. We could hear it.
Okay, so
Cholesterol is a
so
useful
what you see is a coronary artery, and the disease of these arteries are called coronary artery disease. It's called coronary artery disease, and the blockages of such can cause chest pains, which is called stable angina. It could lead to unstable angina, and it could reach a point of having what we call acute coronary syndrome, threatening to cause a heart attack. So there's a whole spectrum.
lipid
What you see, those yellow particles are cholesterol particles called LDL
that the
cholesterol.
body needs to control digestion, make steroids, and maintain healthy cell membranes. Cholesterol is carried through the bloodstream in particles called LDL. Everyone needs cholesterol in the proper amounts. But if there is excess LDL in the bloodstream, it pushes inside the artery wall and accumulates where it doesn't belong. The body interprets this as an invasion that touches off a natural inflammatory process to try to limit the infection.
So the cholesterol is very much needed. We need fat in the nourishment. We need cholesterol. It is required for hormones, the membranes, for the brain. But we don't want too much of it, and we don't want the bad kind of it. So these yellow particles that go in the blood are called low density lipoprotein particles. They can get into the walls of the arteries due to various reasons, due to diabetes, due to high blood pressure, which is not controlled, due to smoking, due to inactivity, due to poor nourishment, being sedentary, which is happening a lot in this COVID times. So these cholesterol particles can go and start a plaque or a blockage, and we won't have any symptoms at this stage. If it were to reach 80%, 90%, when we exert, there's not enough blood going to the heart muscle, and we can get discomfort, we can get fatigued, we can get short of breath. It's different symptoms in different people, but most of the people notice that their exercise tolerance has changed, that they're not as energetic. Climbing up a flight of stairs, they're feeling little less able to catch their breath. So the blockage at this stage cannot be recognized by any stress tests or by any symptoms. But this blockage can cause a heart attack just as much as a severe blockage. It's not how severe the blockage, it is how vulnerable, how unstable the blockage is. So this lining that you see is our shield, kavacha. So even if we were to have a blockage, if we can thicken this membrane, we can prevent a heart attack. So it's never too late. First, it would be best to not to have a blockage, but should we happen to have a blockage and go into sattvic lifestyle, we can thicken this membrane. But this illustration is about a person who has not controlled his risk factors well.
Inflammatory cells are called into action, literally swallowing the invading LDL until they form a lipid core inside the artery wall. Now it's crucial to keep this lipid core away from the blood because the core has a strong clotting agent. The inflammatory process sets up a protective barrier by forming a cap made of a tough, fibrous matrix.
The common denominator for a lot of diseases is inflammation. When we don't eat healthy, we don't nourish well, we are not active enough, we are more sedentary, our bad hormones, bad chemicals, and the inflammation in the body increases. That could lead to truncal obesity. So these inflammatory cells are responsible for dissolving this fibrous cap and exposing the blood to the cholesterol. And once the membrane becomes too thin, that becomes unstable.
Too much cholesterol in the body can set up a process that spirals out of control and could cause a heart attack. Cholesterol
I'm sorry, I think it went back.
Cholesterol is a useful lipid that the body needs
So
to
this
control
shows the
digestion,
cholesterol again getting
make
deposited in
steroids,
the walls of
and
the
maintain
artery.
healthy cell membranes. Cholesterol is carried through the bloodstream in particles called LDL.
You can
Everyone
move
needs
it to the
cholesterol in
center.
amounts.
Yeah,
But if there is
if I
excess
could.
LDL in the
Yeah.
artery wall
Yeah.
and accumulates where it does, this as an invasion that touches off a natural inflammatory process to try to limit the infection. Inflammatory cells are called into action, literally swallowing the invading LDL until they form a lipid core inside the artery wall. Now it's crucial to keep this lipid core away from the blood because the core has a strong clotting agent. The inflammatory process sets up a protective barrier by forming a cap made of a tough fibrous matrix, and for the time being at least, the fibrous cap is strong enough to keep the plaque separate from the blood. But eventually, the inflammation breaks down and weakens the fibrous cap that was the last line of defense between the clot-causing lipid core and the circulating blood. This lesion has now reached its most dangerous state. And in this vulnerable state, the plaque is an accident waiting to happen. Any one of the many typical daily stressors that are normally harmless could be the last straw for a vulnerable plaque, triggering a rupture in the cap. With a cap rupture, there's nothing left to prevent the mixing of the plaque's clotting agent with the blood. The likely result is a clot in the artery. Now, the extent of clot formation and the damage it may cause could range from minor to fatal. The most unfortunate ending of that vulnerable plaque story would be a large occlusive thrombus that causes the heart muscle tissue to die from lack of oxygen. If too much tissue dies, the entire heart can stop working, suddenly killing the patient. This is the story of how too much cholesterol in the body can set up a problem.
Can you see this?
Yes.
So one of the most important things to prevent a heart attack, should we be having it, or should somebody we are nearby is having, is to seek help, is to call 911 within the United States and say if they're sweating excessively, they're not feeling good, they're short of breath, they're having chest discomfort. The typical symptoms are that something is sitting on the chest, like an elephant is sitting on the chest, or it's squeezing, you feel a sensation of squeezing. You could have tightness, you could have symptoms going into the jaw, you could have symptoms going into the arm, or you could have just in the arm, or it could be just in the jaw. Some people feel it in the abdomen, like kind of indigestion feeling, because it's affecting the bottom part of the heart by the right coronary artery. So here is a patient who is about 45 years old, who presented with some kind of epigastric discomfort, presented his EKG, which we first do right away in the emergency room, showed changes suggestive of a heart attack. And the time is essence. So first we need to get to the hospital, and then they need to open up the artery within 60 minutes. That's called door to balloon time. So this is an angiogram which lasts about a minute. Let me play it for you to have an idea. So these are the arteries on the left side of the heart. We take a few pictures to make sure there's no serious blockage. The heart is still beating. This main artery going to the front of the heart is called left anterior descending, and this is circumflex. So here you see the blockage which is causing the heart attack. You see that, where it's quite narrowed. And then we put a wire through that, and we put a balloon to expand it like you see here. And we do it really fast. And then after we open the balloon, you'll see there's better blood flow going down. And then we put a stent that you see here, and we expand the stent so that the blockage is fully expanded and the artery has almost normal appearance after it's fully dilated. So we are expanding the stent by the balloon, and we'll take out the balloon and the wire, and the stent remains there. This is called angioplasty. This is called stent. This is the fastest way to restore blood flow to the heart muscle and stop the heart attack in its track. So I will stop there with that video.
Let's talk myocardial infarction.
Uh, so can you hear me okay? Did I sign out?
Yes, 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 yes.
Okay.
No, we hear you fine.
So if you have any questions to this part, I would like to, Gaurav, would you, anybody has questions or should I continue?
If there are any questions on what we've heard so far, you can please either type or unmute yourself and ask your question.
I know it's a funny question to ask. So, but if you do the surgery and put the balloon and, repair that artery, does that person become more healthy?
Okay, so I just want you to realize the angioplasty is not fixing the cause of the blockage. It is like a band-aid. Obviously, the person gets more healthy because we are stopping the heart attack. Because once the muscle is dead, that part muscle is dead. You can't bring it back. But what we are trying to do is not let any muscle die. So we can do that up to 6 hours, 12 hours. But each minute, more and more muscle is dying if the artery is completely blocked. But most of the time, it may not be completely blocked. It is closing and it's opening. It's closing and opening. Part of the artery is trying to form a clot. The natural fibrinolytic system is trying to break the clot. So the first thing is seek help. Take an aspirin. Give them aspirin because blood clot is the final denominator of that clot. But aspirin doesn't prevent the blockage that is formed. That is formed by usually poor lifestyle. So I'll get to that. So the person is healthier because his heart muscle is not damaged anymore. The heart attack is stopped. His heart muscle is as good as any other time if it's done right away. As time goes, hours go by, there is more and more damage. Then they are left with some damaged muscle, and some with such a weakened muscle, they're not as strong as before. They get winded. So the muscle function is measured by ejection fraction. The heart fills up with blood, kicks out blood. Fills up with blood, kicks out blood for the whole body. The normal ejection portion is about 55 to 70% of the blood it fills in. So once there is damage, it could become 40%, it could become 35%. Initially, after heart attack, it might look like 35%, but the heart muscle is stunned. And after we open up the artery in 3 to 4 weeks, it returns to the best it can. So a lot of people, if we open up the artery within 1 hour, 2 hours, they have completely normal heart muscle function. If we were to open it
Yeah, I have a question.
6 hours later, there is some damage, and that is myocardial damage and left ventricular systolic dysfunction. It's weaker. So that person is not as healthy as before his heart attack. So this is not a cure for the heart disease. It's a cure for the heart attack.
Correct.
So we still have to do the things to prevent new blockages from forming and figure out what caused the blockage in that particular person and treat them all. And the most important
Can I ask you one question?
If I could have we all, have you all realize is the best is good lifestyle. That is the best prevention.
So we have a question, doctor. We have a question.
Yeah, I wanted to know, can there be multiple blockages at the same time? And how do you treat them if in case it happens?
Yes, that's a good question. There are people with a heart attack. It's usually one artery causing the heart attack at that time. So we fix that artery. But they could potentially have blockage in the same artery in a different place. They could have blockages in another artery and its branches. So you could have people with blockages in 5 vessels, 3 vessels, or 2 blood vessels. So what we do is we first open up the artery and stop the heart attack. If there are any other critical blockages at the same time, we might fix at the same time. There are other times where there's a 90% blockage, 80% blockage. We let them heal from this heart attack and bring them back and fix it. There are other times we fix the artery that has causing the heart attack, stop the heart attack, and then they have severe blockages that they may need bypass surgery, which is in that particular case, based on where the blockage is, how the arteries are, how many blockages there are, we determine whether stent is better or bypass surgery is better in the long run. So that is more than what I wanted to share here. I wanted to go for the prevention rather than the treatment which I do. I want to decrease my business. So I'm going to cover a lot of these things as I speak, and maybe Gaurav can moderate the questions after 20 minutes so that I can get the points that I feel are very pertinent to the audience. If you could be patient with the questions for a short time, maybe I could cover it, but feel free to interrupt me, because I can't say you ask me questions and I can't say don't ask me questions. So it is very informal.
My recommendation to everyone is, if you have a question, just type it into the chat window, or just say I have a question, and when we pause, I will come to you at the right time.
Doctor, I have a question. I'm sorry.
So would you just type it into the chat box and hold it until we come back to the questions again?
Okay, I will. Thank you.
Thank you.
So what we don't want to happen is not to have heart disease, but it could have happened. We born to a family with increased incidence of heart disease. We might not have led a good lifestyle, but it's never too late. So we can thicken that membrane, which is covering the plaque, by healthy lifestyle. So you could have a 80% blockage and have a full lifespan without having a heart attack. So it's never too late. And that we could probably address in the questions. So is it our destiny? Is it karma? Is it inevitable? Is Indians being Indian, that's it, it's our karma? And I would say absolutely not. 80% of the heart attacks are preventable. 80% of heart disease is preventable. So this is in our hands. So what leads to that blockage that you saw, the cholesterol entering the arteries? It's usually is high levels of bad cholesterol, diabetes, smoking, blood pressure, being overweight, and most important thing is inactivity. The conditions of these, you all know. The condition before these that are even recognized prior to that is called metabolic syndrome. And we have noticed of all the people that have heart attacks at a young age, 2/3 of them did not have diagnosis of diabetes, did not have diagnosis of hypertension, hyperlipidemia, because they're 45, they don't see a doctor. They don't even feel unhealthy. They feel perfectly fine. They're going about working 16, 18 hours a day. They don't take the time to eat and chew, don't take the time to do things that you all promote, meditate and yoga, and eat a sattvic lifestyle. So the 4 pillars to prevent heart disease is physical activity, good nourishment, good attitude, and good sleep. And all these can be, the activity and good attitude are helped by yoga and meditation, because all the things that are not done well increases the inflammation in our body. And that condition of that high inflammatory state is called metabolic syndrome. So metabolic syndrome is a condition where we start to develop increased waist size, more than 36 inches in men, more than 32 inches in women, associated with 2 other things. It's either a sugar more than 100 milligrams when you fast, a bad cholesterol, good cholesterol less than 40 in men and less than 50 in women, and triglycerides more than 150, or blood pressure being slightly high, either more than 130 or more than 85. So having an increased waist size along with any of the other 2 conditions is called metabolic syndrome or syndrome X. Why I'm saying that is, this is the condition just prior to actually developing diabetes, blood pressure, or obesity. So if we can see the next slide, Gaurav, what it is the increased waist size will lead to a lot of fat in the abdomen. So the increased waist is not because we have gained muscle or our organs have become heavier or our brain has become heavier. It is because of the fat we gain. And a lot of my friends say, Ravi, I'm in the same weight as I am when I got married. And they say, look at yourself. And they're the same weight because they have, even though they developed a little belly, they lost muscle. So it compensates. So even though they're the same weight, it is the bad weight. They have abdominal weight but they have less muscle, so the weight remains the same. The fat is lighter and the muscle is heavier. So this is a condition which my hope is that with a good sattvic lifestyle, we don't reach. So it is important to identify that this obesity leads to not only diabetes, high blood pressure, lowering of the good cholesterol, increasing the triglycerides. It also, poor lifestyle leads to increased risk of cancer, increased risk of depression, increased risk of arthritis. So this talk is for all the conditions, not just for preventing a heart attack. So overweight, sedentariness increases 13 types of cancer. And all these are on the slides, which I didn't want to show right now. And Gaurav has them, and he'll be very happy to share them because these are not my personal property. So diabetes is becoming a pandemic like COVID in India. There will be millions and millions of people with diabetes. And in my business of preventing heart disease, the tape measure is as important as a stethoscope. So can we do something about it? So the most important thing we all can do is what I had mentioned before, the 4, is if you're smoking, not to smoke, have physical activity 30 to 60 minutes a day, averaging 45 minutes. And that could include yoga, the postures of yoga. It could use Surya Namaskaras. We don't need to go to a gym. And balancing our diet, which I'll go more over. All this good sattvic lifestyle prevents us from gaining weight and increasing the inflammation in the body. However, we might be feeling good. Yeah, you might look like Gaurav, but could have a heart attack. Why is that the case? Because we could have been born with high risk of having lipids, even though we eat healthy. Some of us produce more bad cholesterol. So some of us might develop blood pressure because of the stresses at work, even though we are trying to do good things. So it is important that we see a physician every year to make sure we are not developing blood pressure, we are not developing diabetes, or our cholesterol and triglycerides are not in control. This is very important. So what are the symptoms and signs, which I went over briefly with heart disease? Is with heart attack, I mentioned the symptoms. With developing a blockage, heart disease is various kinds, but I'm just focusing of the coronary artery disease, right? The blockages in the arteries. So the symptoms and signs could be decreased exercise tolerance. It could be shortness of breath. It could be having mild ache in the chest that we say, you know, maybe I'm out of shape. So any change in your exercise tolerance is worth reporting and seeing a doctor. So in terms of full lifestyle, sleep is very important. We all need 7 to 8 hours of sleep, good restful sleep. And what will happen to get a good sleep, what is necessary is eating healthy, good nourishment, good activity, and good attitude. So if we are having 50 to 70,000 thoughts coming into our brain in a day, we need to be able to calm them. We need to get into a state where our body is fully relaxed. And for those, yoga and meditation, and Gaurav and his team can say more than I can, being the experts. So the stress is another important. Stress drives us. Stress is good. It increases the catecholamines to achieve things, but there's also stress not taken in a proper way. It could be a negative factor. So making negative stress into positive stress, enjoying the things we do, accepting them as they come along, and all these things are thrown at us. This COVID, there seems to be no end to it, and this will probably continue until July. So when there are things that we cannot change, why should it be harmful to our body? So how we react to it is in our control. So we need to take care of ourselves, especially in these times, because if you realize the people that are dying from COVID are the people who are not healthy, the majority of them. In our institution, the mean body mass index of the people getting admitted, we have admitted close to 6,000 patients so far, in our 15 hospitals in Southern California, Kaiser Permanente, the mean body mass index is 30, the normal being 20. So most of the people are obese. Most of the people that are dying are obese, who are elderly and who have some medical conditions. So if we can do these things to promote good health, it is actually prevents getting very sick from COVID. Like 99% of the people don't get very sick. The mortality rate, if we take all the people that get infected, will be less than 1%. We are not testing enough. High blood pressure is related to poor lifestyle. So if we control our weight, control our diet and salt intake, blood pressure improves. But sometimes we'll need medication in spite of those measures. So the factors, Gaurav, if you could show the slide of the slide number 30, is that it's not just one factor that leads to coronary artery disease. It is people with increased age, people with high triglycerides, total cholesterol, people who are smoking. So each of these are incremental. People who are good cholesterol is low, the male sex up to the age of menopause, beyond menopause, females catch up rapidly with male, diabetes and being age. So they're all like additive. We can't control aging, we can't control our sex, but we can control rest of these things, can't we? Salt has been increased in our diets over the generations. So we need to keep an eye on that. Increased salt leads to more heart disease, more strokes, more deaths. So we need to keep an eye on that. It's costing almost $24 billion annually in the US. You all know about cigarette smoking. It will kill more than 8 million people worldwide each year by the year 2030. There is more and more younger kids doing vaping, thinking that it's less harmful. It is not. We are hearing very young children getting admitted with very severe lung problems. One of the most important things that can drive is inactivity is equal to smoking. So we might say, I'm not smoking. None of us smoke in this audience, but being inactive is just like we are smoking. It is like diabetes. It is killing more people than smoking, with about 5.3 million people dying annually from inactivity, as opposed to 5 million people, 50 lakh people dying from smoking. So this is the knowledge we need to have to understand what this heart disease is. So you don't really need a cardiologist to tell you what to do to prevent a heart attack. So we need to believe these things. You know, like a mantra, it is so short, but it's so effective. So simple measures make very big difference. Plato said, slide number 37, lack of activity destroys the good condition of every human being, while movement and methodical physical exercise save it and preserve it. Whether I said it or not, this is very pertinent. This hasn't changed since 400 BC. The wise people of those times, our yogin, our acharyas, some of the greatest teachers of yoga, look at them, they lived up to the 80s and 90s. They lived a very simple lifestyle in terms of nourishment. So coming to physical activity, the more the better. Any chance you get to move does benefit. Simple things like just taking the stairs as opposed to the elevator or escalators. Moving around while you're speaking on the mobile phone, stretching, simple things, chair yoga, in between meetings. Every little thing decreases the negative hormones, negative chemicals, increases the endorphins or the good ones to decrease the harmful levels of the inflammation. In addition to the activity, we need to look at the diet. We need to balance the diet. A study in England showed of 45,000 people, vegetarians had 32% less likelihood of dying, and needing treatment as a result of heart disease. As Hippocrates said, let food be the medicine and medicine be the food. So this diet we have, vegetarian, plant-based diet, is taking off now. All the scientific communities, scientists dealing with cancer, dealing with arthritis, inflammation, heart disease, are promoting plant-based diet, including cardiologists. What are not really good are refined sugars, soft drinks, sweetened fruit drinks, desserts, too much salt, the fats of the saturated kind, and hydrogenated fats they use in cookies and sweets and deep fried foods. So we need to realize there's always a tomorrow. We don't need to eat all of them today. And there is websites called My Plate from the government. There are a bunch of slides I have showing how plant-based diet, how plant proteins, and how a wholesome diet with good fats, good carbohydrates, prevent heart disease, prevent heart attacks, prevent bad health. It helps in a very comprehensive manner. So for example, I'll share one of the slides. If you look at the slide from 48, Gaurav, and that is about dying from heart disease. They did a study from 1988 to 2006 of 100,000 patients. And if the sugars are added sugars, which happen to be 10 to 25% of the total calories are from added sugars, the increased risk of death is by 30%. But if our calories are more than 25% from added sugars, the mortality increases by 3 times, 275%. So these are very dramatic things that happen with such refined sugars. And if you look at slide 51, if we can replace the animal protein with plant protein, we decrease mortality from many causes by 20% and from heart disease by 23%. So unhealthy lifestyles show that associated with animal protein increases mortality, and with plant proteins it decreases. So Mayo Clinic says eating primarily plant-based foods, replacing butter with healthy fats like olive oil and canola oil, using herbs and spices instead of salt, limiting red meat to more than few times a month, and eating fish and poultry at least 2 times a week for the people who are eating those fish and meat would be good. Ideally, completely plant-based diet, which is slide number 55, Gaurav. Yes. So this is what I have just stated, and these slides are available for Gaurav to share with anyone who's interested. You can email him. And the next picture, if you could show, we'll just go to the pictures as you show them. Basically, not so good are foods like this, which have a lot of saturated fat, ghee, they're deep fried, a lot of salt. There could be vegetables in there, and we need to look for them. Next slide. What would be better is to have more of these of fruits, vegetables, nuts, and salads, and these can be made quite tastily. And we can no longer, next slide, we can no longer eat these kind of rich foods as though we are a poor man. We cannot afford them in terms of our body, not by by our purse. So next slide, please. Michael Pollan is one of those experts in nourishment and has written extensively, including a book. So that is about nourishment, eat food, not too much and mostly plants. And the vegetarian food in our Indian restaurants is not all of them are very healthy. And so we spoke about activity, we spoke about nourishment, and the other thing is yoga. It is a union of the body and mind. And I think the main goal of yoga is It's just not postures, it's physical health, mental health, social health, spiritual health, and the realization of the divine within us. You know, our body is a temple. We don't take pizzas and these kind of dishes to the temple. We as prasad, so we shouldn't put it to the God within us in our bodies. We need to take care of it. We need to nourish it. We need to nurture it. What I say is eat right, exercise right, and don't take yourself too seriously. And this is from our Ayurvedic text. Looking at slide 63, what is our risk of developing heart attack at age 95 based on how we are at age 50? So at age 50, if we don't have any risk factors, which are like total cholesterol more than 180, blood pressure more than 120 or over 80, smoking, and having diabetes, these are the risk factors. So at age 50, if we don't have any of those, our lifetime risk of developing heart disease is only 5% to age 95. So we are not going to have it if we don't have any of those. But if we have more than 2 risk factors, it is 68% chance that we'll have heart disease within the next decades. So this is a very preventable disease. Even if we get it, we can prevent it from getting worse by these lifestyles. To ensure good health, eat lightly, breathe deeply, live moderately, cultivate cheerfulness, and maintain interest in life. This is by William London. And the next slide speaks for itself. Jim Rohn. So with that, I would go to the last slide called 69. So if we do all these things, so Gaurav, I'm open now. Maybe I went too long. Sorry about that.
No, it's fine.
This is fantastic. Okay, so let's go through questions. I'm just going to take them in sequential order. From Sindhu, any symptoms when inflammatory cells come into function? Are there any symptoms when the inflammatory cells come into function?
So there are no symptoms for a blockage. There's no symptoms when you have a little belly or your inflammatory condition is high until it reaches a point where your blood pressure goes up. And that's the reason we need to see the doctor every year to see if our blood pressures are going up, if our cholesterol is going up, our triglycerides are going up, or our sugar is going up. These are all inflammatory markers. And when we look ourselves in the mirror, we should just not see the face. We should just look down a little bit and see how we are. And that will give us an idea. And when we exert, it will give us an idea if we are in a good shape or not.
Sure. How does HDL help the heart? This person says their HDL was never above 40, even though they were at, this was at age 30. Is there any problem?
So Gaurav, that's a good question. Let's see what this HDL is and what this LDL is. HDL is like garbage trucks, HDL. H is high density lipoprotein. Let's give it a name called healthy lipoprotein. High density lipoproteins, H is healthy. LDL is lousy. So LDL is the trash. It's always a lot more than HDL, which is the garbage trash truck. So this trash is getting deposited everywhere. The LDL, like you saw in that video. HDL is the garbage truck that picks it up in that form and brings it back to the liver.
I see.
So it's a protective form of cholesterol. It brings it back to the tissues, whereas LDL is trying to go into the blood vessels. So we won't have enough cops, HDL. So we need to decrease the robbers, the thieves, so we need to, we won't be able to increase the HDL a whole lot, but we can decrease the LDL.
I see.
And if need be, by medication, in spite of the lifestyle if it's still high. Am I clear? Or
Sure, yeah, yeah. So essentially, you can't really do much about the HDL directly, but you can reduce LDL and through your lifestyle and other choices. Makes sense. Sure. Next
So
question.
HDL,
Sorry.
HDL does increase a little bit by physical activity.
Sure, okay.
It does increase a little bit by wine, but that's not the reason we should be drinking wine, because along with wine, our calories increase, our belly increases, our blood pressure increases as well in excess. So it's a balance.
All right. The next person says, this is a vexing sort of the complex thing. They're vegetarian, non-smoker, non-alcoholic, no junk oily food, no sweet food, no soda, good hours of sleep. It's all good. Eat very little food, and yet their triglyceride is out of range. So they snore a lot, they're gaining weight, and they're out of breath frequently. What would be your advice?
It's unlikely that if you're in a good shape, that you'll be out of breath quickly. So if they're practicing all the lifestyles, are they saying they're not on the heavy side?
They're gaining weight.
So the gaining weight, it is like increased calories that our body doesn't need get stored initially as sugar, as in the muscles and in the liver. The most you can store is about 1500 calories. Beyond that, excess calories get deposited as fat in men in the abdomen and women around the waist.
Yeah, but they're saying they eat very
little.
little.
You're having more calories than you need.
But they're saying this person is saying they eat very little. They're not eating a lot. So it's not that.
I would say they maintain a food diary and an activity diary. Every minute we walk, we burn 4 calories, average person. Heavier person more calories. So if we walk for an hour, we burn 240 calories, but one gulab jam, we get 400 calories. So it's a balance. They don't probably realize the snacking, some of the fruit juices and all, they all add up, the calories. So they need to maintain probably a food diary and activity diary and see the balance.
I see.
And
what about, sorry.
And talk to an expert.
Yeah, sure. Talk to an expert. Sure. What about sugar substitute? Can you talk about the risks of PID?
Like the sugar substitutes that we see in the coffee shops and all.
Sure, yeah.
They don't have any calories. They're chemicals. Every food is a chemical. We don't know the long-term effect of 10, 20, 30 years from now. So all of them don't cause problems right away, right? So some of these chemicals make subtle changes in our cells and mutations that can increase the risk of cancer and all that. I'm not saying that's the case. We just do not know enough. So more natural way of feeling sugar. So the people that need to add a little sugar might be getting addicted to the sweetness. Even though they're not getting calories, by adding that sugar substitute, they crave for sugar. The best is not to eat sugary foods in an added sugar form. Eat it in a natural form in the fruits that come,
Sure.
Fruits, if whole fruit is better than fruit juice.
Whole fruit, yeah, you have the whole fruit instead of just the juice. That makes sense, yeah. Now another question is reducing blood pressure by lisinopril, metoprolol, prolol, and amlodipine is the right way to reduce blood pressure, and what are the side effects?
Okay, that's a very broad question because there are 3 different medications. One is a beta blocker, one is a ACE inhibitor, and one is a calcium channel blocker. So this patient's blood pressure is quite high, or this person's, I'm not saying a patient. Sure. They're requiring 3 different medications. So without any doubt, all of us have to practice healthy lifestyle. That's number 1 to prevent getting that stage. We have shown by decreasing weight, we can decrease blood pressure by promoting a healthy lifestyle, relaxation techniques. Vivekananda Institute in Bangalore has done a lot of research among many other institutes, and they've shown the mindfulness, yoga, sattvic lifestyle decreases blood pressure. So food can be poisonous too. It can be medicine, but it can be poisonous too. So good nourishment, good activity, good attitude will decrease blood pressure. And after that, if it's still high, you increase your activity, you decrease weight. And some of us can have high blood pressure in spite of all the above, then you need medications. But we have seen people on 3 medications who are on the heavy side and not very active. By promoting all these things, they can decrease the doses of medicines and the number of medications.
That makes sense.
What is, without any doubt, we all have to practice good lifestyle.
Everyone's noticing that it's good to see a doctor who's actually smiling when they're talking about heart disease. So, thank you for doing that. So another question is, their triglycerides are out of range. Is it possible to reverse them?
Triglycerides are a reflection of fat storage. That's a storage form of fat. Carbohydrates, like a lot of rice, like me from Andhra Pradesh, we eat tons of rice. You know, everything is with the rice. And those get easily, absorbed. And then you're hungry again because it's a processed form of white rice. Then you eat again. Not that your body needs it, your blood sugar gets lower. You have enough calories in the body. So the triglycerides is a form of, to a lot of us, of a poor lifestyle. But some of us could have high triglycerides in spite of the best of measures, then we need to be on medication. But most of it can be reduced by good lifestyle.
Sure, yeah. How much dry fruits can one eat? Pista, almonds, cashews, dates, ghee. There's a couple of people who asked whether ghee and whole milk must be avoided.
You could go to that website, gov, myplate.gov. It has a lot more, Kaiser Permanente has good links. Basically, the portions of fruit we need to eat, the number of nuts we need to eat. Like President Obama, apparently at nighttime, he used to have like 10 almonds next to him when he was relaxing. And each almond is probably like 8 calories. So yes, it gives us good things, but we don't want to overdo the nuts and overdo the fruits as well. So we have to realize that all these things have good things, but we have to do it in moderation. So few portions of fruits every day, handful of nuts every day. I hope that answers it. To be more specific, the nutritionists and the experts have given them in the website.
Yeah, so maybe, Doctor, what we'll do is maybe have a nutritionist come back and address some of these questions in a follow-up session. All right, this is fantastic. Our time is up. I wanted to thank you, Dr. Ravi Jandhyala, for being with us today and making this wonderful presentation to us. And also, I've left the email for the HCI ID community plus heart at hinduci.org. If you want a copy of this presentation that we saw or this recording, I'd be happy to send it to you. With that, Lataji, may I ask you to do the closing prayer?
Yeah, thank you very much. That was a very beautiful presentation. And also throughout the presentation, you're smiling, which is what we are all being told to do as yoga practitioners. So.
If I could make a comment.
Yes.
My grandfather is a physician. Mm-hmm. And he used to go with a horse cart in the 40s and 50s to patients in Vijayawada. Then he had the third car in Vijayawada, different cars, and he used to go and visit patients, deliver babies in their homes. And he used to, in a padaka kurchi, like a reclining chair, he used to wait in the evenings in the veranda for house visits. And he died at age 66 from a heart attack. And my father is a physician as well. He had a heart attack in his 40s and bypass surgery at age 51 and is going strong at age 87 now. So it's never too late. My father outlived his father by 20 years. And so if we all practice some of the things the experts have taught us, we will do well. And thank you for this opportunity and namaskar.
Sure. Thank you. Namaskar.
Thank you, Doc.
Everyone? Yes. Everyone bring your hands to Namaskara Mudra with a nice smile like the doctor. Keep a smile on your face. Let's do a closing prayer. Inhale. Om Sarve Bhavantu Sukhinah Sarve Santu Niramaya सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् ॐ शान्ति शान्ति शान्तिः. Slowly rub your hands and cover your eyes, and with a few blinks open your eyes in your palm. Namaste, doctor. Thank you very much.
Namaste.
Thank you
Thank
all
you
for,
very much.
Thank you, everybody.
for joining. Yes.
Thank you.
Thank you.
Thank you.
Good night and stay safe, everyone in Northern California. Please stay safe and out of trouble. Thank you.
Thank you.
Thank you.